Good afternoon. Welcome to day 310 at the EMA office where we bring you the latest in the numbers. Sam, we have some numbers today and some we don't because of the state having some issues.
Yeah, the state had some technical difficulties, so we don't have state numbers to provide to you today, but we do have local numbers for St. Clair County. So as of today, 235,156 St. Clair County residents have been tested, which is an increase of 1,674. We have 24,314 positive test results, which is an increase of 139 from yesterday. And that does include both males and females from under the age of 1 up to their 90s. Today, our daily county positivity rate is 8.3%. And we are at 210,842 negative test results. Unfortunately, we are announcing one additional death, which does bring our total for St. Clair County to 376. That was a male in his 60s who had unknown health conditions. And as always, our sympathies go out to his family. For those who have completed the IDPH required 10-day isolation period, we are at 22,007. As I said earlier, we do not have any updated state numbers for you today. For St. Clair County hospitalization numbers, currently we have 100 patients that are admitted due to COVID-related reasons, and 12 of them are on ventilators. Regionally, we have 175 patients that are admitted due to COVID-related reasons, and 16 of them are on ventilators. We do not have any updates to our congregate living facility list today, and since we do not have any state information, we do not have any zip code updates today either. So I believe we'll be moving right into questions. Is that correct?
Well, I think we've got a few numbers, at least with the daily county positivity.
Oh, yes.
And you may have
you're
talked
right.
about
I'm sorry.
that, but with 139 new positives in St. Clair County and 1,674 people tested, that brings our positivity down again today to 8.3%, which brings our rolling average to 9.9%. The state, as of January 13th, has our regional positivity at 9.8%. Those numbers are significant because if we get below the 8% level, and then we have other metrics that we have to meet, which we aren't right now with hospital beds, availability, those type of things. Once we start to meet those metrics and we are below 8%, then the indoor dining with 25% capacity can start again. So the numbers are down, and they're trending that way, but we need to be ever vigilant. And in Herb, I think part of being ever vigilant now includes the potential for people to get vaccinated. We've been made aware that in Monroe County tomorrow, there is vaccination for people 85 years and older. If you go on the Illinois Department of Public Health website, you can sign up, get a ticket. They will have, I think they have enough doses for 600 people tomorrow. They've already been through about half of the sign-up, so there's about 300 left as we're talking live right now. I'm sure that will go down as people know this is available. But go on the Illinois Department of Public Health website. It'll say you can pick Adams County or Monroe County where they have excess vaccine, and they'll be vaccinating those 85 and older.
Right, and we was receiving calls here at the EOC about that today, so we're sharing that information with them. And just to go back on the numbers you said are trending down, and we can do this. We found out yesterday Region 5, which is the southern part of the state, was allowed to move because they got their numbers, both their positivity rate and their hospitalization rate under the metrics. So it can be done. We just got to keep working at it, and Team St. Clair has been doing a great job of that.
And when I say excess vaccine, I mean that we're not through Category 1A yet, so all of our vaccine is still going for the hospital workers, the emergency frontline workers. That's part of the CDC requirements of how we use our vaccine. Until we get through 1A, we're not eligible to go to 1B. It appears from the IDPH website that Monroe County is through their 1A, and they don't have hospitals or the medical system that is here in St. Clair County. So that would make sense. But so with their next with their 600 doses that they have, then they can start on 1B. And they're choosing to go to the 85-year-old population. But it isn't just for Monroe County residents. It's for, this is federal vaccine, so it's our understanding that anyone can get the vaccine from any part of the state of Illinois. So we would encourage people, go sign up. It's available, and the vaccine is starting to roll out, which is all good news.
That's what we want. And I think, Sam, you reported that this coming week that at 330 West Main, our site, that you're still doing some of the frontline workers
Correct.
there.
So we will have no testing this week at 330 West Main from the 18th to the 22nd.
Very good. Okay, and we'll keep everybody informed on that on our daily briefings. Brian, it's question and answer day, and we have quite a few of them.
We do. We'll start with the health department questions. Sam, first question's about vaccine. Will it be by appointment when we get the vaccine?
For St. Clair County, yes. We will have appointments that you'll be able to sign up for that will give you the date and time for your specific appointment.
Okay, now will that possibly change with our meeting that we're having Tuesday? I know that's a $64,000 question.
If I had to say right now, I believe that we would still use appointments simply so we don't wind up with the situation of knowing, we're only, and when I say appointments, so we know how many vaccines we have to give that day.
Right.
So you may sign up for a date, and it may say you can come between the hours of 8 a.m. and 4 p.m.
Yeah.
So when I say appointment, that's what I mean. So
Very
we don't
good.
have 500 people that have been waiting in line that aren't able to get a vaccine. So
Right.
appointments in the sense of, yes, it will have you sign up, and it will tell you what date and what time frame you need to be there within.
And the bottom line is once we get that information in concrete, signed, sealed, and delivered, then we will let everybody
Oh,
know
absolutely.
on the briefings and
Yes.
on the websites. Very good.
Absolutely.
Thank you.
Okay, the next person said, looking for clarification. Everything on IDPH's website talks about a statewide plan for vaccine distribution. How are some counties entering phase 1B while we're still in phase 1A? Shouldn't all counties finish 1A and then everyone start 1B at the same time?
So in an ideal world, yes, but you have to look at each county individually. Some counties are much smaller than others. Some counties do not have a local hospital that falls within their jurisdiction. Us in St. Clair County, we have 3 very good-sized hospitals within our county, and we have a lot of medical offices, doctors' offices, and medical staff that fall in that 1A category as well. So it may take some counties a little longer than others to get through that 1A population simply because of the medical facilities that they have in their area.
And to piggyback on that, I don't mean to chime in here all the time. It's the lack of product. If we're not
Absolutely.
getting our share of the vaccine, we're in a holding pattern.
We can only give vaccine to those that we have vaccine for.
Right.
We can't give it if we don't have it. And so we're working through 1A as quickly as we can, but as Herb said, that does depend on the allotments that we get for our county.
And we're told that the allotments are going to start getting greater and greater,
Ramping
and
up,
this
yes.
is going to roll out. And just like the PPE discussions of 300 days ago, these rationing discussions will go away as the vaccine rolls out.
Exactly. And it does take some time for these manufacturers to ramp up their productions, produce it, get it out to the state, and then the state distributing it to each individual county.
Well, that's a very good point, Chairman. 300 days ago, everybody was trying to beg, borrow, and steal PPEs. And it took a lot of work from you and the state representatives and to get that supply chain going, and it got worked out.
Okay, the next question says, in addition to completing the St. Clair County vaccine notification form, should an individual contact their primary care physician to see if they will be administering the vaccine?
So you certainly could. I can tell you at this point right now that no primary care physicians have received the vaccine to give yet. It is very possible that they will down the road, but at this point, they do not have the vaccine in office to give to their patients.
But if you qualify for the vaccine and you have an opportunity to get your shot, get your shot.
Absolutely, and that will be at a vaccine setup. For us, we're looking at 2 locations in St. Clair County. As the chairman said, Monroe County has one for tomorrow for those 85 and older. So just keep your eyes out. There will be a lot of information coming out for all of the different vaccine sites that are going to be around you.
Okay, the next person says, HSHS St. Elizabeth's paid their employees from Springfield pay and mileage to come to the hospital in O'Fallon and receive their vaccine. How is it fair to take vaccines from residents of St. Clair County? Springfield is our capital and has vaccines of their own. How could the health department allow this to happen?
So again, that can fall under what the chairman and I were just talking about how many each county was allotted. So St. Elizabeth's Hospital did let us know that, they fall under the HSHS umbrella, and they had some staff members that did live out of county but work for HSHS, and they did let us know that they would be coming to St. Elizabeth's to get their vaccine. And just because you live in one county does not mean that you can't go to another to get the vaccine. That is certainly doable. You just have to look and see what's available surrounding you and your surrounding counties, and to see what group they're on.
And those were employees of HSHS.
That is correct.
It's not like they were the general population.
No, they were
Right.
employees of HSHS, which that is the hospital system that St. Elizabeth's is part of.
Okay, the next person says, once you start vaccinating, how long will it be before we know if it's doing any good?
So what I can tell you is, obviously, especially since this is a new vaccine, we have reporting systems that allow us to report any adverse side effects that anyone may have. Those go straight to the CDC. The CDC then will look at each of those on an individual basis to see how severe was the reaction and to see if they need to be followed up with. But again, this will all take some time, as it does to compile all of this information and all of these numbers. So I'm sure soon that we will be getting some information from CDC and IDPH on how people are handling these vaccines.
And I think that it also, the question also, begs the question, how will we know if the vaccine is working, like they say, to the 95% protection level? Really, the way we're going to know this is when we drive this daily county positivity down, that we're really using vaccine to get us to herd immunity, if we want to use that phrase that we've heard so much. As more and more people get vaccinated, as more and more people in this community are immune, then those numbers drop, because that's fewer people out there that are going to be infected. Unfortunately, we're hearing that this virus is mutating, and that the strain that was in Great Britain is now in Illinois. It's been announced, and we think, at least what we hear, is that that strain would keep growing in this country, may even be the prevalent strain. It's more contagious than the current corona strain that we've all been talking about these 300 days. So that may also change the picture. As the virus gets more contagious, here we are vaccinating. What will all those numbers do together really is a question that remains to be seen. But one thing that isn't a question is, you need to get vaccinated when it becomes available to you. You need to wear your mask, wash your hands, watch your social distance, stay out of crowds until the time that we get the positivity level driven down to a point where it's no longer a worry for our community.
And I think that's one of the misconceptions that I'm seeing, even some comments today. People feel that, are asking, if we get the first vaccine and the second, does that mean we don't have to wear a mask anymore? And that's the farthest thing from being right. You still are going to have to do that. You got to wear these masks, you got to wash your hands, and watch that social distancing. Just because you get the vaccine doesn't mean you can go out there and just you're scot-free.
Because the vaccine is not 100% effective.
Right.
There's still, from the numbers that we see, and we're really repeating what we hear from the doctors and the scientists, but they say it's 94, 95% effective. That means that there's still going to be a small segment that are going to contract the virus, just like with the flu vaccine, that a certain number of people still get the flu after the vaccine. But these numbers are pretty high. I mean, 95% is that's a pretty good opportunity for you to not get COVID. But until the positivity rate gets so low that you don't have to worry about being infected, you need to wear the mask and wash your hands and watch the crowds.
Okay, the next question says, what percentage of congregate living facility staff have refused the vaccine, and how can vaccine refusal be addressed?
So we don't track the number of people that have refused to take the vaccine, and vaccine refusal, or people refusing the vaccine is totally optional. It's not required. And so everyone has the right to say, yes, I'm going to accept the vaccine, or no, I'm not.
Okay. Next one, I think we've talked about this, but I'll go through the question. It says, I'm a teacher in St. Clair County, but I live in a different county. And am I able to sign up for vaccine in St. Clair even if I'm not a resident?
Yes, you are.
Okay, next one says, still I am uncertain what category 60 to 64-year-olds with no underlying health conditions are for the vaccine.
So those individuals would fall into category 1C.
Next person says, is there a way to check and see when you signed up for the vaccine if it went through?
So there is not, once you hit the submit button on the vaccine notification form, at the bottom of the page, right next to the button that you click to submit it, it will say form submitted. And that is how you will know that your form was received successfully.
But be aware, you didn't sign up for the vaccine.
Correct.
You signed up to be notified when the vaccine would be available
Exactly.
with St. Clair County.
Exactly, yes. Please keep in mind for anyone that does, as the chairman said, this is not to register for an appointment. This is simply for us to have your information, so when we hit the category that you fall into, we are able to send you out the information on how to sign up.
And if you are signing up, and if there are those fields that are required to be filled out, if you make a mistake and don't do that, it won't let you go forward.
Correct.
So-
There are certain fields that are required that you fill in.
Yes, I had a gentleman call this morning and couldn't get it, and he was forgetting to put the hyphen in between the phone numbers, and once I told him that, he was able to go back in and submit it, so just simple mistakes like that.
Okay, next person says, I'm supposed to be 1A, but I don't work at a facility which is vaccinating on site. If you move to 1B, will I be able to get my vaccine at one of those sites as 1A?
Absolutely. So when we move from 1A to B to C, just because we move on to the next category doesn't mean we shut the door. Okay, so I'm sorry to everyone. We had some technical difficulties. We saw that we got disconnected, and hopefully we are back up and running now, and we won't have any further issues. So we apologize for that.
Okay, so the next question we'll move on to says, if I choose to be vaccinated and get my first dose, what guarantees do I have that my second dose will be available at the time I need it?
Again, all the information that we've been given from the state has assured us that we will get continuous doses, amount dependent, but that we will be continuing to receive vaccine in St. Clair County.
Okay, the next person says, will a communication be sent so it's known that our survey was received? Even though I saw the message that appears successfully submitted, will I get any other type of communication confirming receipt?
No, you won't. All you will see at the bottom of that form is it will say form submitted, and that's how you'll know that we received your information.
Next person says, is there an approximate date when the vaccine will start for the public, and where will that be done at?
Again, no, we are unsure of when we will move to 1C at this point. Again, our priority is to finish 1A, which is all of our hospital and medical staff in St. Clair County, and it will be dependent on what our future allocations are from the state and how much we receive. But I can assure you we will work as quickly as we can to get through 1A and 1B to get to the 1C category.
Okay. The next person says, will you have sites in different towns to receive the vaccine?
So at this point in time, our plan is to have 2 vaccination sites, but there is always the possibility that we will be branching out into either mobile clinics or having satellite clinics in other areas of St. Clair County.
And that all depends on the availability of vaccine.
Yes, that is what a lot of this circles on is, how much vaccine we receive in St. Clair County.
Okay. The next says, what are the reasons for vaccine to be wasted, and how many doses in St. Clair County have been wasted, including the hospitals, CVS, Walgreens, or the health department?
So I can tell you that we have been in very close contact with all 3 of our hospitals in St. Clair County, and that there has been no wastage of COVID-19 vaccine up to this point. All of our staff that works at the hospitals knows how important this vaccine is and how valuable it is, and their priority is to get it into the arms of our St. Clair County residents. So, one of the ways that potential wastage could happen is if there is breakage of a vial. Unfortunately, accidents happen, and that's no one's fault, but that is an example of how vaccine could be wasted. But I can tell you our hospitals have not had a single dose that they have charted as wasted. So we're very proud of them for that. That takes a lot of time and effort and coordination to get those appointments set and to have people coming in, because it's a dance to make sure that we don't waste any.
And that all falls under their quality assurance. If there would be an incident like
Absolutely.
that, they have to document that and submit it. So,
Correct, and we
we've not
notify
received
the
any of that.
state
Right.
immediately upon receiving those shipments if there is any breakage, that we see in those containers.
Our health officials, they want to get this vaccine out as much as people
Absolutely.
want to get it. So
Absolutely.
they're doing everything they can to make sure 100% of it goes to good use.
Okay, the next person says, since there will be a lot of people in category 1B, will you be categorizing further when you send out notifications? And will they need proof to show that they should be in that category?
So yes, we will be subcategorizing all of the categories that fall under 1B, and we will most likely be doing very similar as to what Monroe County is doing. They've started 1B, and they are saying at this point 85 and older. We need to prioritize those that are most vulnerable in those categories, and we have seen with our numbers, not only in the number of positives we've had, but obviously it's very clear in our long-term care facilities that those higher age group brackets are the ones that are being hit the hardest.
Okay. The next person says, if the hospitals in Region 4 are taking patients from other regions, how will our region ever meet the bed requirement?
So unfortunately, when you have larger hospitals and specialty treatments at certain hospitals, that is just part of the game that smaller hospitals that don't have the resources have to transfer outpatients to the larger hospitals. We have said from the beginning that we've learned a lot since COVID started. Our physicians at these hospitals know more now than we did in the beginning about treating COVID patients and, what works and what hasn't. And so we take that, and with people getting the vaccine, with people continuing to wear their mask and follow all of the guidelines that IDPH has set out, hopefully in the coming weeks and months, we will see those numbers drop, which will then, which will lower the amount of people needing hospital care for COVID-19.
Well, we have said for the 300 days, because that's one of the questions that some of the people always say, well, why isn't the flu bad this year as it has been in the past? And even the physicians that we've had on here said that they contribute a lot of that because of the precautions that we've been taking because of the COVID, of wearing the mask, better personal hygiene. So, that's kind of self-explanatory,
Okay, next one says, some of our living facilities have aggressively and effectively mitigated their risks of death and slowing case occurrences, but others haven't. Does St. Clair County share best practices and enforce or audit those practices at various facilities?
So the answer to that is yes. Any of our long-term care facilities that have needed anything, we've always made sure that they know that we are available for resources, for guidance, and we've made ourselves available to them. And if needed, we can have the IDPH department that focuses on long-term care come in on a conference call, and we can be on there and the long-term care facility to kind of work through any steps that they may have on how to have better infection control, how to isolate those individuals that are COVID positive. So yes, we do make ourselves available, and all of our long-term care facilities have put in a lot of work to keep their residents and their staff as safe as possible.
Okay. Another one here says, I've been tested multiple times. On the statistics, do all of those times count as one, or does each one count individually?
They count individually. Every test result is counted.
Okay. Thank you, Sam. Chairman, a few questions came in about restaurants and mitigations and stuff like that. So I'm going to kind of go through these. The first person asked, why are we not allowing indoor dining, but we allow students to eat lunch together in a school cafeteria?
So the school program, that's handled by the school board. They're the ones that make those recommendations. They do work with the health department in putting all that together, and the Illinois Department of Public Health. So those are decisions that are made on that school board level, and it's really up to them, and it seems to be working for them. Otherwise, they wouldn't continue to do that.
Okay. Why isn't the health department enforcing restaurants that are staying open? Have they given up? Do we need to remind them that the virus is still among us?
The virus is still among us. Our positivity rates remain way too high. And we are not going to get to reopen if we can't get our levels to fall below that 8% positivity level. The only way we do that is, and the only way available to drive down those numbers is to wear a mask, wash your hands, watch your social distance, and when the vaccine becomes available to you, get it. So it's now 4 W's. Wear, wash, watch, and when. And when it becomes available, you get that vaccination. Those are the ways we're going to be able to get reopening again. The health department is still out monitoring restaurants, and we really ask for the local officials in those communities to be a big part of this, not only the notification, but the enforcement levels. They're the ones charged with this, as we are also. They need to step up if we're going to be able to get the positivity rate to a level that we need it, and get those hospitalizations and those bed numbers where we need them to be. You know, people can argue about what positivity number means, and is it a good number? Well, it truly is a leading indicator of these hospitalizations. It has shown when our positivity rate goes up, in short order, the hospitalizations and the bed usage goes up also. So let's keep those numbers low, let's get them lower, and then we can all get to a point where we need to be.
Well, I think, Chairman, some of the stress and fatigue that our Team St. Clair members are feeling is just like now when another county is announcing that they're doing the 85 above. There's nothing wrong with that. It's just as Sam just explained, we have a lot more healthcare workers, a lot more of the doctors, the frontline workers that we have to get through other than our smaller counties surrounding us. And then again, it all falls back to the amount of vaccine that's available.
And they have 600 extra doses.
So they want to use it.
They've gotten through their 1A. It doesn't do anyone any good sitting on a shelf. It only does good when it goes into someone's arm and gives them that immunity. Right. So we don't have any issue with other counties getting to 1B before we do. We are the medical center of Southern Illinois. We got more hospitals, more medical professionals here in St. Clair County than I believe about anywhere. Madison County may disagree with that, but between the two of our counties, we certainly have the vast lion's share of the medical community, and that's why it's going to take us longer to get through 1A, because we've got more people to vaccinate, and we need more vaccine. So the more vaccine we get, the faster we can get through 1A, the sooner we can get to 85 and above and 65 and above, and then the 1C category that I fall into, we'll get there too. But it requires vaccine, and then the people necessary to put it in the arms, and that's what the health department's working on and has together.
So the bottom line is, if you can go to another county that is offering that, please go get it. We want you to roll your sleeve up and get the shot, because that's the only way you can help be a part of that solution. So don't feel bad if you go to Monroe County or Madison County or wherever. Please go get it.
The state of Illinois, this is the state of Illinois. Illinois has given that vaccine not for just use in any one county. It is for the use of citizens of the state of Illinois. The federal government has sent the vaccine to Illinois to be used in Illinois. So these Maginot boundaries really don't apply. If you can get that vaccine, get it. That's the key.
Next person says, why is Gary's restaurant in Freeburg opened? I've called the village mayor and the village administrator and never get a return call. It's obvious from the start that the village leaders haven't taken this virus serious. What is going to be done about that?
Well, we'll turn this into the health department. I would encourage you to get a hold of the mayor. I'm sure they're out in the community, I would assume, and let them know you're concerned. Let them know the reason why you're concerned. If we don't have those local partners, the local people to help us in their community, it's difficult to go in and to know every place that's open if we don't have eyes and ears of the local officials that are working and pulling in the same direction that we are.
Okay. And the last question that came in for today says, when will St. Clair County allow indoor dining? Restaurants in Clinton County have already done it.
So the answer to that is as soon as it is legally available to us. And that, we've talked about those numbers earlier. But basically, we got to get those hospitalizations down, and we have to get the number of beds available up, and then we need to get our positivity rate below, the regional positivity rate below 8%. So no place should be open right now in Region 4 unless they shouldn't be open until we meet that criteria. And the state is putting that into effect in this region so that we can lower those numbers and raise the number of bed numbers. If someone's cheating, if someone is violating the law and allowing it, they're keeping these numbers higher than they need to be for longer than they need to be, and everyone suffers because of that.
Well, and the bottom line on that is that there have been some of those establishments and some very few of the communities throughout the county that from day one has been resistant on doing that. But, you know, as 310 days came upon us, and it seems like forever, the numbers have shown that this virus is here. It's been here, it's gonna stay here for a while until we get all of this vaccine in everybody's arms. So the best thing to do to be a part of the solution is let's continue to do what we have to do. It can be done. We just showed you yesterday, Region 5, southern part of the state was allowed to move their mitigations back. So we can do it too, with the help of everybody. Team St. Clair, please keep sharing it, keep telling your friends and neighbor. Most importantly, get your shot when it's available to you. Tell your friends and your family, wherever you got to go get it at, get it. And we'll get through this, as we've said now, for 310 days. We'll be back in a few moments to translate this into our Spanish communities, and then we'll be back tomorrow for day 311. Thank you for joining us, and everybody have a good rest of the evening.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year, and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together, we will stand strong.
Buenas tardes, hoy tuvimos a Sam Buren del Departamento de Salud que nos informó los nuevos casos del condado de St. Clair County, que son 235.156 personas examinadas, con aumento de 1.674 nuevos exámenes y 24.314 casos positivos, con aumento de 139 nuevos casos en el condado, hombres y mujeres en la edad de 1 año a 90 años, 210.842 casos negativos, con 376 muertes, con una nueva muerte, un señor de 60 años sin problemas médicos previos, y 22.007 personas han completado la cuarentena requerida por el Departamento de Salud de 10 días. Y hoy no hay números estatales ni códigos postales. Y en la región 4 estamos al 9.8% y hay 100 personas hospitalizadas en los hospitales de St. Clair County, con 12 personas en ventiladores. Y de esos números, en la región 4 tenemos a 175 personas hospitalizadas, con 16 personas en ventiladores en la región 4. Y hoy tuvimos una sesión de preguntas. Y la primera pregunta a Sam del Departamento de Salud fue: ¿en qué lugar pueden registrarse para la vacuna del COVID? La respuesta es en la página. Los residentes del condado de St. Clair County se pueden registrar en la página del condado, y ya cuando sea su tiempo por categoría ellos le avisan. La segunda pregunta fue la segunda pregunta fue cuando la vacuna sea disponible, si va a ser por cita, y la respuesta es que sí. El Departamento de Salud le avisarán a qué hora y dónde va a ser la vacuna. Otra pregunta a Mark Hearn fue: ¿cuándo podrán los restaurantes estar abiertos de nuevo? Y la respuesta es: hasta que los números bajen no se podrán hacer cambios por orden del gobernador. Y finalmente, todos se recomienda que sigan usando el cubrebocas. Muchas gracias.